welcome to the clinic.
Hi. I have an appointment with Dr. Kreimel today for my 6-week postpartum checkup
Okay, what time was it supposed to be at?
at 10:45.
Okay, and what's your first and last name?
Come in.
Oh, hi, how are you?
Hi, how are you?
Good, Kristen, nice to see you again.
How are you?
Doing good, thank you. Hope everything is well?
Doing pretty good.
Good.
Nice to see you again.
So, I see that you're here for your checkup,
Yep, my postpartum checkup.
and I see also that you have a couple questions about birth control.
Yes.
Okay, so before we go ahead and do the checkup, I'm gonna send Lacey in to discuss that with you,
Okay.
and then afterwards we can have a talk between ourselves too.
Okay.
Sound good?
Yep, sounds good.
Alright, any questions before we do the checkup?
No, not yet.
How's a little baby?
She's great. Getting big.
Alright, see you soon.
Alright, bye. Thank
Bye.
you. Come in.
Hi, Kristen.
Hi.
How are you? I'm the nurse. My name is Lacey.
Hi. Nice to see
I
you.
heard you wanted to talk a little bit about some different birth control methods that we
Yes.
offer.
Yep, I don't have another baby this soon again.
Okay, well, I did bring in two most common forms we have. We have condoms here,
Okay.
and we have birth control pills, which are you take one every day for the whole month.
Okay.
And birth control pills are very common. They contain estrogen and progesterone. You take one pill a day at the same time to be most effective, and it basically keeps the eggs from leaving your ovaries, and it makes your cervical mucus thicker to not allow the passage of sperm. They're very effective, but you have to remember certain things like some antibiotics will cause them to be ineffective, and you risk the chance for being pregnant if you're taking antibiotics. And don't forget, if you accidentally vomit during the day, that can actually make your pill not work as well because you're basically throwing it up. And we also do have condoms, which are, I'm sure you know about them. They're worn on the penis, and Planned Parenthood offers them for free if you can't afford them. They're safe and effective and can be used with birth control as well as extra protection, but they aren't 100% positive forms of birth control because they can break, they can slide off, other things like that. And you want to store them in a dry place as well. And they are good, unlike the birth control, at helping reduce the risk of getting some STIs that can be transmitted. So do any of these sound like an option for you, or I don't know?
Based on my culture, I can't use condoms, so I'd be more interested in taking the pills.
Okay, so this birth control pill is called low estrogen, and like I said, you'll take it once every day, and you put the sticker strip on the day that you're going to start it. You take once every day, and the two little pills at the end are iron pills, so those are good pills to take as well because they'll help with giving you nutrients and vitamins and stuff like that.
Okay.
So what I can do is have Dr. Kamel leave a prescription at the desk for you, and then you can make a follow-up appointment with Tamara at the front
Okay.
desk to come back if you don't like it or if you need to change something, okay?
Okay, for the birth control, I can start on any day.
Yeah, they used to think that you weren't able to start it on any day, like they would say start it after your last period, but there's new research that says you can start it on any day, so don't worry about that.
Alright.
Okay?
Alright.
Perfect, thank you.
Thank you so much.
You're welcome, have a good day.
Thank you.
Come in.
Hi.
Hi, welcome to the clinic.
I'm going to see Dr. Kreimel again.
Okay. And what's your name?
Kristen. Last name is Ward.
Did you have an appointment?
No, I didn't. Last time I came in, he gave me birth control, and this is the 4th month I've been taking this stuff, and I've been getting sick every single month. So
Okay.
I was wondering if he could possibly give me something different that's gonna help me not get so sick.
Okay, I'll let him know that you're here. And can you give me your birthday?
Yep, 12/18/86.
Do you have insurance?
Come in.
Hello.
Hi.
Kristen?
How are you? Yep.
Hey, how are you?
Good. How are you?
Doing good, thank you.
Hi Kristen, how are you?
Hi, I'm good. How are you?
Good.
Okay, so, welcome back.
Okay, so I have some questions. Last time I came in, I talked to Lacey, and she had brought up condoms and birth control for birth control pills. Sorry, for birth control methods. And because of my culture, I can't use the condoms. So she gave me the pills. I've been on them for about 4 months now, and I've been getting very, very sick with them. I just don't like them. I mean, I've been taking them as I'm supposed to. I've been going down the line, but I don't like them. So I was just wondering if there's anything else. Since I can't use the condoms, I can't use this. There's gotta be something different I can use.
Yes, there are options. I'm sorry to hear that this isn't working out for you. But we do have a variety of options you can pick from.
Okay.
First one is, of course, abstinence. If that doesn't work out for you, then there's always a pull-out method. But I'm sure you understand that that is not a reliable method,
Mhm.
okay? Moving on, there is an IUD, that stands for intrauterine device.
Okay.
This is a very convenient thing. It's a small device, T-shaped, it goes into the uterus. And it just gradually releases hormones that keep your body from getting pregnant.
Okay.
Now, it's very safe, very effective, very popular, but it requires professional installation.
Okay.
This isn't a home application thing.
Okay.
There's something called a birth control patch. It's a transdermal. You can put it anywhere on your body. This is by prescription only. It is hormones, but the danger with that is it may fall off and you have to worry about reapplication and so
Okay.
on. So there's that. There's a device called NuvaRing. This one goes in the vagina instead of the uterus, circular shaped. They're in there for 3 weeks at a time, so pretty much every month you put a new one in.
Okay.
Those are very effective too. But you do have to deal with the reapplication again. And the ones for the future doses, they need to be refrigerated.
Okay.
Something you should know about those is that there's a possibility that they may fall out. In which case you just pop them right back in. But if they fall out and you don't realize it and then go on to have intercourse, the danger of pregnancy is present.
Okay.
Okay? There's common side effects, breast tenderness, and bleeding between periods.
Okay.
Okay? There's one called a implant. This is matchstick device, very small. You place it into your arm. And this is another hormone therapy. Lasts for 3 years at a time. It's a surgical installation. Very effective. Most common side effect is irregular bleeding.
Okay.
Okay? Let's see. Do you have any questions about any of these?
I heard online that breastfeeding is a control, like a birth control method. I breastfeed, so does that work or how does that happen?
Well, breastfeeding is kind of like your body's way of protecting itself from getting pregnant immediately after pregnancy. It's another form of hormone therapy, and it has been documented with some success, but it's not a reliable measure.
Okay.
And I would not suggest using that exclusively as a birth control method.
Okay.
Okay?
And then I've also heard things about STDs. I can't use condoms, so what do I do about that?
Well, I'm looking through your chart here, and you've been tested, and you're negative for everything. So right now you're safe. I'm not sure the testing history of your partner. I would suggest getting them tested and just document it going forward. But none of these that I mentioned will protect you from STDs.
Okay.
The only thing that really will do that are condoms, because there's a physical barrier.
Okay.
Okay?
Alright, well I think I wanna try the IUD.
IUD is a good choice. Okay.
Get it put in and I don't have to worry about it.
Okay. We actually have a specialist in the office that can come and talk to you more
Okay.
about that.
Okay.
All right?
Alright.
So you just wait here and I'll send her right on it.
Okay, thank you so much.
You're
I'll see you next time.
Thank you.
Have a good day.
Bye, thank you.
Bye-bye.
Bye. Come in.
Hello,
Hi.
how are you?
I'm good. How are you?
Mrs. Antoine, I'm the IUD specialist.
Hi, I'm Kristen.
Nice to meet you. So they told me that you were interested in using IUD as a form of birth control method?
Yeah, I was trying the birth control pills and they're making me very, very sick. So when the doctor went over the different methods, this one seemed like the easiest. It goes in, I don't have to worry about it.
Okay,
So I'm
great.
gonna try it.
Good suggestion. And I'm just gonna give you a little information about IUD, and if you have any questions, please feel free to ask me, and then we'll have the doctor come in later. Okay.
Okay.
So IUD is T-shaped. It's an intrauterine device. It's a copper and hormone device. Okay, basically it just blocks the sperm from joining with the egg.
Okay.
Okay, and it's one of the most effective form of birth controls. That's why I think it was very wise of you to choose the IUD as a form of birth control method.
Okay.
However, it doesn't protect you from any STDs
Okay.
because there's no barrier there between you and your partner like a condom would. You might have some mild to moderate pain with insertion, and there might be some spotting or cramping for the very minimum.
Okay.
Okay, some of the 3 most common problems are the device can sometimes slip out of the uterus. You can develop an infection, and sometimes it can push through the walls of the uterus. However, this is very rare. It's not common that these things happen.
Okay.
Okay, do you have any questions for me?
No, sounds good.
Okay, so we're gonna have the doctor come in and do the insertion for you, and then afterwards we're gonna do an ultrasound to make sure that it was placed properly.
Okay.
Okay?
Alright.
Alright.
Yeah,
So
see you
we'll
later.
have the doctor come in, okay?